Dr. Jennifer, you are host now. I believe you are still muted. I think you'll have to unmute yourself. Thank you, ma'am.
Okay, let me know when do we start? We
we can start anytime. It's just that I feel people are still gonna be coming slowly. Yes, but
I'll admit them in.
Thank you very much. I appreciate that. Well, we're good to go. It's 6:09. So maybe one more minute and then we'll start.
Okay. Yeah.
We can start now. Thank you. So good afternoon, everybody. My name is Taya Omekan. I'm the executive.
Thank you very much.
Sorry?
Carry on.
I'm the executive director for LCCMedia Foundation. It's a foundation that believes in information dissemination to the end that people's lives might be impacted for good. What we have done this time is we have partnered with Foundation for Black Communities, federal government, to bring information to the community with regards to the vaccines and the current, pandemic and how the vaccines affect us and our community. Without further ado, I have Dr. Jennifer Jenga here, who is very qualified, and a nurse, Ibiana Lee, and they are here to talk to us about the vaccines and how it impacts us and our community. Dr. Jennifer, I will yield the floor to you and have you introduce yourself. Thank you.
Correct. Thank you very much for that introduction. So yes, I'm Dr. Jennifer Jenga, the CEO of Canada HomeCare Group. And I've got my colleague Ibian Ali on the on Zoom as well here to add what I have to say. Ibian's out in the community with her colleagues, other nurses, and they vaccinate people. They talk to people about COVID, and they get to hear all about the challenges and the thoughts and ideas and what people are kind of looking at, especially after being through this pandemic over nearly 2 years now. So just following up from last time we talked a bit about the vaccines. I talked about what COVID-19 was. I talked about the science that we have, of course, the vaccines, and we talked about some of the myths behind vaccines and talking about the facts behind it. There were things that were brought up last time about those fears, of course, to be vaccinated. We talked about some of the stuff on social media, which is unfortunately, some is not very helpful. People talked about the 5G and the magnetic connection with the vaccines and then the religious issues as well, even about being vaccinated or not being vaccinated. Then we looked at some of the statistics globally in Canada and globally. And so today I just want to carry on and talk about some updates and things that have been happening recently. Last time we talked about variants. I want to touch on variants, and I also want to talk about the latest, some of the stuff about, we're getting a third COVID vaccine or we're not. What are some of the other countries doing, especially as, the country opens up, we need to start traveling. How does that affect here in Alberta, Canada? So that's just in a nutshell. So we'll have the discussion at the end, I think. I think that's kind of what we'll do. So just a few statistics. I just love numbers because they give us that, context and let us know what's happening. So currently in Alberta, we're looking at 146 people in hospital right now. 36 are in ICU. We've had to date 2,331 total deaths, and to date, this statistic 12 by end of day August 11th 2 days ago, 101 active cases. Our positivity rate is 5.47. Talk a little bit about that, really. The average death here is about 80 years of age. So many people have been vaccinated in Alberta, which is a good thing, over 5 million. 76.6% of 12 plus have had at least one dose. And I put in brackets just a comparison to see where other countries are at. In the USA, they say that's is 69.1. In the UK, they're doing really have received at least their first dose. And then 67.4% have been fully vaccinated. In the US, those figures are 58.9%. In the UK, again, leading 75%. So just giving you some data, current data, as of 2 days ago at least. So we know this came from Alberta Health, that there was the opening up of the province, close contacts of an individual COVID-19 will no longer be legally required for the latest stuff that was said today. So every day things change. Dates change all the time. At that time, that was the plan. Individuals with COVID-19 symptoms and confirmed cases will still be required to isolate. Hotel rooms for isolation will be available, but on a reduced basis. And then the plan was from Monday, the 10-day isolation period following a positive test result will no longer be mandatory, but will be strongly recommended. And there'll be isolation hotels and quarantine. So this was out last week. As of last week, this was out. I just admit a few more people. So again, this was today. As of today, there are some outbreaks in Alberta Health Services and some of their facilities, unfortunately. In the Edmonton zone, we've had one death reported in Royal Alex. In South Zone, there is an outbreak there as well. What is of concern? Alberta Health reported 550 net new cases of COVID-19 on Thursday, marking the second day. It's just going to read this as it is because this is marking the second day in a row. The daily case count surpassed 500 mark. So we're really rising up in cases. Of course, it's summertime. People are out there, they're interacting, and maybe not being as cautious as they should be. The number of known active cases now up to 4,101, an increase of 332 since Wednesday's update. So unfortunately, it's the first time active cases has gone above 4,000. So we need to be a bit, I think, a bit more cautious. And we see most cases in Calgary, followed by Edmonton zone, South zone, then North zone, then. So just some updates. So we are not yet out of the woods. Maybe there's light at the end of the tunnel. We can discuss that later. So again, some updates, 336 more cases of coronavirus variants of concern. These are the ones we're going to be talking about, identified in Alberta. So we know that we had the original COVID-19, but now we have variants. So the virus has mutated, and now we have variants. So the total of known active cases is up to 3,197. So we've already talked about some of those cases already. So the one thing I want to say about this slide, the changes that had been made previously that were to start on August 16th on Monday are now going to be delayed until September 27th. So publicly accessible transit, taxis and ride shares, mandatory isolation for 10 days for those with COVID-19 symptoms or positive test result, testing at assessment centers for any symptomatic individual. And of course, Dr. Henshaw was citing rising hospitalization rates. She's also concerned that unfortunately, they have exceeded projections by more than 60%. So there is not a very good thing. They knew the cases would rise. I mean, we obviously knew that. But this is on. So the number of COVID patients in Alberta hospitals has grown from 91 at the start of the month up to 146 as of Thursday's report. The 36 Albertan reported Thursdays be getting COVID-19 care and intensive care. We talked about those people. this is just the last bit there. I was just talking about, despite all that's happening, and that might change to masks. We know kids are going back to school. Children not being, it says masks will be mandatory in Alberta, so how that's going to work. But students and staff will still have to isolate if they test positive for COVID-19 or asymptomatic. So I'd like us to have a discussion about that maybe at the end. What are people thinking? There might be parents on this platform who are listening. Now children can go without any masks. What does that mean for parents? What are your thoughts as well? So just some things coming. And as they say, these things change with time. The updates, they keep on updating us and changing the rules as things unfold. So points of concern. So when a virus is in the air for a long time, unfortunately, it tends to mutate, and this one has mutated, and we'll see the various variants of the original virus. We have the alpha, gamma, beta, and delta. The problem with the variants, there's increase of transmissibility. So this one you can catch very easily. The variants, you can catch them easily compared to even the original virus. They tend to bring about more severe hospitals, and unfortunately many have succumbed. There's significant reduction in neutralization by antibodies generated by infection or vaccination. So even though we're saying, yes, we're going to vaccinate, but we know that the variants are quite a big problem. There's reduced effectiveness of treatments or vaccine and diagnosis detection failures. So the variants really are of concern at this stage. So this is a slide from the Government of Canada. So as of July the 8th, just looking at those variants where they are, how many in the other provinces, but just to give us an idea, in Canada, we had 219,811 of the alpha. This was the original, the UK one, sorry. Then we have the beta, the gamma, the delta. What we're concerned about now is the extreme end. I say the right side, the delta variant. Everyone knows it originated from India, and it's now here in Canada, in Alberta. So just to give you a context, that's where we are with the variant. That was as of July the 8th. These numbers are going up. And just to explain the variants, the alpha variant, I guess it's a lot of scientific stuff here, but we'll just pick on treatments. Treatments are effective against this variant. So whatever is being given now in hospitals, if you are unfortunately admitted in hospitals, there is an antiviral drug called remdesivir, which has been approved by Health Canada. This one can help with the variant. This was the variant identified in the UK in September 2020. That's the alpha one. Then we have the beta variant. There's some treatments that can help against this variant. This one came from South Africa in May 2020. So we have the alpha variant, the beta variant. So alpha from the UK, beta from South Africa, and then gamma from Brazil in November 2020. And then we have the one from India, October 2020. We saw lots of people dying in India. I think it was horrible sights seen on TV, people, bodies being burnt, etc. So those are the four variants we're now struggling in the world, and even here in Alberta. And we're saying that unfortunately the variants, unlike the original virus, they tend to be more aggressive in terms of disease, and also they don't respond as well to treatments. So I'll talk about the Delta variant, which is the worry across the world, that's really killed off lots and lots of people. It's highly more contagious, nearly twice as contagious as the previous variants. So some data suggests that Delta variant might cause more severe illness and death than the previous strains, again in unvaccinated persons. Unvaccinated people remain concerned. And so although breakthrough infections happen much less often than infections in unvaccinated people, individuals infected with the Delta variant, including those who are fully vaccinated with symptomatic breakthrough infections, can transmit it to the others. So this variant, unfortunately, can pass on from one person to the other. The vaccine provides us with protection. So if you do get the variant, you're still protected, unlike someone who's not had the vaccine. And that's what the last point where they're fully vaccinated people with Delta variant breakthrough infections spread the virus. Yes, you can spread it. However, vaccinated people appear to be infectious for a shorter period of time. So you're infectious for a shorter period of time and you don't get as much severe disease as you would if you're not vaccinated. So people ask us, okay, so you're giving us these vaccines, what about the variants? Yes, Pfizer, Moderna, and AstraZeneca, all three of them have been proven to provide protection against infection and the severe outcomes with the from the variants. So effectiveness, 1 dose. So like I said last time, we're having people who've had their first dose, but have not gotten around to getting the second one. And interestingly, some people have even refused to have their second vaccine. And we talked about some of those reasons where someone said, oh, I had the first one, I was very, very sick, or I heard my friend or my auntie got the second one, unfortunately. But if that's the case, then the one vaccine is not enough to give you immunity against the variant. As you can see, your immunity is still very low and you still are susceptible to severe disease. Once you've had both vaccines, you have you can get more immunity and you're able to fight off the disease caused by the virus. So dose of COVID-19 vaccine. To date, we are only being told to vaccinate people with 2 vaccines, right, here in Alberta. The Quebec government is offering an extra dose of mRNA vaccine to people who want to travel to countries that don't recognize the vaccination status. So some countries do not recognize the AstraZeneca vaccine that was given. And so people in Quebec have been offered that opportunity to have a 3rd dose so that if you've had AstraZeneca as your first dose, you may have Moderna, but you can get a second one, which is a Pfizer Moderna. That way, it kind of gets rid of the of the first dose that you've had. But that again is out of choice. It's not mandated. Some countries are also looking at a 3rd dose. Other countries like France, Britain, and Finland. I think Britain has a plan. The UK has got a plan to give people a 3rd vaccine. We haven't again here thought about it in Alberta. I just want to emphasize that because we've been asked, going out to vaccinate people, giving them the 2nd, they're like, oh, when are you coming back for my 3rd one? And we keep telling them Alberta has not given us that go ahead. So yes, people their 3rd vaccine, and they're looking at people over 60 and those who've got other health issues. So they've already started that plan and apparently it's going really well. I just got the last point there. There was I got that from the Alberta Health spokesman, Tom McMillan, said we're particularly watching evidence in the need for booster for people with weaker immune systems because of old age or existing health conditions. So it may be that in Alberta will also go the same way. So we may look at people over 60 and people who have, other health conditions. But as of to date, that's not the case. Of last week, she said, oh no, my pharmacist said I should get a 3rd one. The 3rd one's coming out next week. I said, well, we haven't heard that. We have not received that. So as of now, that is not the case in Alberta. So just some global news. I like to look at things globally as well. I'm a public health specialist, and so I tend to go that way. Interestingly, the World Health Organization has asked the world's richest countries to delay rolling out booster shots, their 3rd shots, to their population before vaccinated. Unfortunately, I think a lot of us on this forum come from Africa originally. Some of the countries there, people have not received even the 1st. So the idea that you're going to have people have been fully vaccinated and now getting a 3rd brings about that inequality. So we're trying to, so I think what WHO is saying is that can the rich countries hold off doing that? The US, of course, has said, they're not going to listen to that. And then just some stats as to why they're saying that. So 30% of the world population has received at least 1 dose of a COVID-19 vaccine, and 15.5% is fully, but to give you an idea of what's going in the rest of the world. That here we talked about, 72 point something people vaccinating their first dose. Around the world, many have not yet received even their first. Although $4.46 billion have been administered globally, and 38.57 million are now administered every day. Only 1.1% of people in low-income countries have received at least one dose. So it gives you that perspective. I always like to think here in Canada with vaccines, and we always tell people vaccines are available. Why don't you have them? Because if you look at the low-income countries, only 1.1% have received the first. So we really at an advantage here, and we urge everybody to take the advantage of getting, take the opportunity to get that vaccine if you can, because it's right there. You don't have to pay for it. Some countries have to pay, get the first shot, to get their vaccines, and people are bringing, like, we take them to people's doorsteps. Pharmacies are calling people to come and get their vaccines. So there are vaccines available. I think 1% of people in low-income countries have received at least the first dose. So we're very privileged here in Canada that saying no is choice. It's not, you don't have the opportunity to get the vaccine. And then just some global information there. COVAX is that's the organization that delivers world countries. It has shipped so far over 190 million COVID-19 vaccines, 138 participants, and those are the I'm going to pause there. I don't know if we should take some questions there or maybe some information, because the rest is about the myths and facts that we talked about the last time. I don't know if I should continue. Tayo, should I continue, or should I discuss?
We could take some questions there. I'm particularly interested about children in the fall and how, I guess, what is the common sense rule for parents to use, especially since the variants, the number of variants are increasing. I'm curious to hear your thoughts on that.
Yes. I would like to hear what people think about that, because the schools are opening soon, correct? And if kids are going to be walking around without a mask, then I don't know. I don't know what's going to happen. But I would like to hear from the audience. What do they think? EBN, I don't know if you have anything to add there as well.
In terms of the kids, or I know a lot of families are hesitant to send their kids masks. Can you hear me, or?
Yeah, I can hear you.
Yeah, I just mentioned a lot of families are just concerned about sending their kids to school with masks if they do mandate that again, or I know that's not, it hasn't been mentioned thus far, though.
I guess my question is, should parents be concerned? Should they voluntarily send their children to school with masks? Like right now with this information, I'm rethinking my own strategy as a mom. What do I do now? And I'm also curious to hear from moms and dads on this forum and what they think and what they're going to do, because I have been vaccinated, right? And for the most part, hopefully it protects me. I believe it will protect me against, but then if you have under 12, or what do you do then? Any thoughts?
I guess, I don't know. I've talked to quite a bit of people too, when they just discussed not every family can make similar decisions in terms of sending their kids back to school or doing virtual. It doesn't work with every family, but just coming up with a solution that best fits your family for this matter. And just taking appropriate steps to your cleanliness, washing hands, same tips and advice that was given previously, moving forward, just to keep everybody safe and healthy.
Yes, I guess we kind of just go back to those SOPs and just, doing the things, the tips that were given, because now it'll be quite difficult in a school environment where, kids are mixing and mingling, and they might be coming from homes where people have not been vaccinated either. So that's another thing. And so, yeah, I don't know what other parents think on the forum. What do you guys think, other moms and dads?
I know there are moms and dads here. I'm curious. I know last year the government gave out free masks and then sanitizer. Do you know there'll be a push like that coming up in the fall? So at least give people starter packs for masks and things like that, even though I know they're not mandating it, but is it something that
I know, talking to some school leaders, that's kind of planned in the school, where there'll be sanitizers at different points, and kids will have to maintain the 6 feet distance. That's all going to be put in place. However, there's that added layer of having a mask on your face, where that's now being dropped. I think there must be some parents worried, like you said, those who are children under 12. I don't know what the thoughts are there, because again, we know that children can also, infect others, right? Transmit the disease. So what happens then?
I hear you.
Is there anybody else who wants to make a comment there?
It's a quiet I guess we should continue.
Can I still say something?
Yes.
So
Please.
Yes.
I'm a dad to a preschooler. She's starting kindergarten this year, and in that sense, she's not in the so to speak critical, easy to infect population. But I'm still concerned, because to my mind, there's, even though they are not as susceptible as adults, there are still cases, right? So just being able to keep myself and herself conscious, to say, okay, keep the hygiene going, wash the hands, maintain the distance, as the case may be, as much as possible. And then, of course, when necessary, wear a mask. Those are things that I would personally consider to be necessary at this time. So even if they are no longer requirements and they're no longer mandatory, at least being able to create that safe space for yourself, I believe, is something that should be allowed, so parents can make choices. That's just my 2 cents.
Yep. Those are very good points.
Thank you.
But then it's even like now, when you walk into a store, some people do not wear masks, others do, right? Like, I kind of tend to take a sort of a quick look around, and sometimes it's half and half. I wear my mask in places. I don't know as to when I go indoors to the store, but the grocery store, it just depends. It depends on the family. I don't know what others think.
I think for me, choose depended on, I find out now that it's no longer a requirement. I forget my masks more in the car than when it was a requirement. I'm not necessarily proud of it though, but I do see that I've kind of relaxed a little bit. And it could just be the fact that it's summer and I just don't wanna, but flu season comes around October, September. I think then I would probably do better, because and make more of an effort and have a case of masks in my car again, like I had when this all started, and have my hand sanitizer and alcohol bottle filled up, But yes, I think that most people are relaxed. Our simple in store are relaxed. And I've heard comments from the community saying, oh, wow, thank God, no more masks allowed. And so I've had, I think 50-50 I see. But I think everybody knows, if you have a pre-existing health condition, right? You know your health situation best. You have to make that choice. That's what I feel.
All right. Okay. So let's talk some more. I know last time we had some very interesting conversation about some of the myths and facts regarding COVID-19 and COVID-19 vaccine. WHO Health Organization tries to pull from different sources. We know the social media has got a whole lot of stuff out there, and I would love to hear some more from people after this, what else they're hearing out there. So some people, you know, they just talk about vitamins and mineral supplements curing COVID-19, you know, and people will say, oh, I take my concoction every morning. We talked about this. I take, you know, my ginger, my vitamins and my zinc, etc. So they do not cure COVID-19. Fact, they're good for your immune system. They do help promote and boost your health, nutritional well-being, but they are not a cure for COVID-19. They're, you know, swimming is another thing. You know, some people were saying COVID-19 can be transmitted while swimming, so that's why we will not swim. No, water or swimming does not transmit the COVID-19 virus. We know that how it's transmitted through droplets from one infected person to another if you've been in close contact with a person. Some of the things we're talking about, the prolonged use of medical masks causes carbon dioxide intoxication. Therefore, you are there for a long time. When properly worn, your medical mask does not cause carbon dioxide intoxication nor oxygen deficiency. While wearing a mask, make sure it fits properly. Don't reuse masks, that's another thing. You need to sort of throw them away, they get dumped, so dispose of them as well. There was a discussion last time about the 5G mobile network to the spread of COVID-19. That's a no. It does. 5G mobile networks do not spread COVID-19. With COVID-19 is spread. But these are the fears out there. These are genuine things out there people are talking about. There's one that says the COVID-19 vaccines make our body magnetic due to microchips that are part of the vaccine. We talked about the ingredients of the vaccines last time, and there are no microchips in there. Instead, we know that when the vaccine is introduced into our body, it helps us create antibodies to fight off the COVID-19 virus. So there's no connection with, you know, microchips. We had someone asking us whether the vaccine has got a number, and he was so okay, like he asked 3 times about this number that we're going to introduce into his body. Walking around, this number will be spotted somewhere, somehow through his skin. And initially I thought he was joking, but actually was very serious. He had heard someone talking about a number that's introduced into your body with the vaccine. So we had to allay his fears. We said, you know, there are no numbers. The vaccine does not contain kind of digits or anything like that. It's just, again, was made for you to get, you know, to create antibodies against the virus. There's the religious bit we talked about last time, the mark of the beast. We discussed that, and you know, for religious reasons, there's some group of Christians or sect of Christians who place the Antichrist is testing human beings by putting a mark on their bodies, and this vaccine, when it's introduced in your body, it creates that mark. Again, the scientists have not created any mark. It's just, again, it's just those ingredients that are to be put into your body that you take in as a vaccine to create those antibodies. The type of masks there, we have the face masks, the surgical masks, and the respirators, and they have what they call filtration, you know, filters, and they're like the face masks are made from polypropylene. Surgical masks have that non-woven fabric, and then the respirators have got also non-woven materials such as wool felt, fiberglass, or polypropylene. So again, no, there are no, you know, marks that are being created in your body for religious reasons. Myths and facts. I just want to ask the group if there's anything else they've heard since, because, you know, every day different things come on social media. Is there a new one we've not talked about? Last time we talked about a few. Are there some more things that people on the forum have heard about in relation to the COVID-19 itself, the virus, or the vaccine? I'll be interested to hear of anything else that you've heard.
I heard that if you ate spicy food, the spicy food will kill the virus. And I say this especially because from an ethnic community, we pride ourselves on the hotter the food, the better the food. And so I don't know. I don't know. What do you think?
Again,
but it kills virus.
yes, again, there's no connection there. People for different reasons, like you said, ethnic reasons, cultural reasons, people do take spicy foods, but no, the spices are not spicy enough to kill off the virus. Again, your protection, best bet is to take both vaccines and be fully vaccinated.
Dr. Njenga.
So that's a good one. Any other? Yes.
Yeah, I have an observation here. In most third world countries where they don't have money to purchase all these sophisticated drugs for COVID-19, they use malaria treatment drugs. That the drugs they use primarily, traditionally for malaria, that's what they use. And what they say is these drugs are just as effective as any other drug that they use in the Western world. But then scientists here in the Western world are telling us that no, malaria drug does not work on COVID. So what do you say?
Yes, I've heard and I've seen some of the studies that they are right now they're currently doing undergoing studies. And you're right, in the third world countries, because the vaccines were not, we've seen that in the third world countries, the poor countries, only 1.1% have received their first dose, right? So somehow they have to find things that work. There was a study, I did see that reports coming through, some of the malaria drugs are effective of COVID, but as far as Alberta is concerned, those are not the drugs we're using, you see. And so, and I do hear what you're saying, because you do get calls, and I'm sure many of you get, information or questions from home asking, can I take this and this and that, or so and so is taking this. Someone WhatsApps your message and say, this is what is working. It's hard for us to say, no, don't do that, because what is the alternative, right? But then again, one of the things that was also found in Africa, some of the symptoms of COVID mimic malaria. So they found that some of the people who've come in and have been given the drugs and recovered were actually having malaria underlying the COVID-19. So they may have been tested COVID-19 positive, but they also had malaria as well. So by taking the drugs then cured the malaria that they had. So that has been an observation. Because when they present, I know presentations, I have some of the, because I still have collegial relationships, some of the doctors back home. Some people present to the hospital, with fever, or you have malaria, or it's COVID, right? So they'll give you those drugs, you recover, because malaria is very common there, right? So that's kind of all I can say for now. I know things are still in the works, they're still testing different things, but that's what I can say, that sometimes malaria is also underlying that presentation of a COVID-19 patient.
I have a question for you.
Yes.
Okay, yeah. So I heard, I don't know, I just heard on social media that let's say you catch COVID and then you get vaccinated at the same time. Is there a negative effect in that?
No, there's no negative effect. Usually they say wait a bit before. So you've had COVID, wait for some time before you get your vaccine, right? Don't get it right away. So what time period are you talking about? You've had COVID and you get
like because I heard, because I'm from Zimbabwe, right? So
Correct.
A lot of people, I just heard a lot of people, they catch COVID, like they find out that they got COVID, and then right away they go get a vaccine.
Mm.
Would that help, or would that negative? Is that a negative? What's the impact on that?
So it's not a negative effect. We're saying that what COVID does, it's going to, of course, you're going to go through the symptomatology of COVID, right? And then it's going to give you those antibodies, right? And usually they say antibodies will run for about 6-7 months in your body, but they're not enough to fight off the COVID-19 itself. Sorry, can you hear me?
Yeah, I can hear you.
Noise. Yeah. So there's no negative effect on that. We're saying, wait, I'm breaking. I can't hear you properly. Are you saying something, sorry? Or is it just me? Hello?
I can hear you.
Oh, you can.
Yeah,
Okay.
we can hear you.
Yeah. So they're saying wait before. So you're saying in Zimbabwe, someone gets COVID-19 and then they go and get the vaccine as a treatment?
Yeah, like right away. Like they don't disclose, like, because like the system back home, right? It's not like in North America where, you know, if you go with your health card number, they know like you already got tested for COVID or whatever. So like some people say that when they catch COVID, they run and get a vaccine right away, of which I don't know whether is there a negative impact to it or is there positive impact to it. I don't know.
You see, you're suffering from COVID-19, all the symptoms we talked about the last time, right? You might have your headache, your fever, your dizziness, your all that stuff. And then you get the COVID-19 vaccine right away, which is also going to give you the same side effects. So I'm not sure that's the right thing to be doing. You know, that's not the right thing to be doing for sure. So we say usually give it some time, have the COVID-19 vaccine, and unfortunately run the course of the COVID-19, go back, get a negative test, wait, and then get your COVID-19 vaccine, right? The COVID-19 virus is going to give you symptoms. The COVID-19 vaccines will unfortunately give you side effects. So now you're struggling with two things at the same time. So which is which? And yeah, so it's not a treatment, it's a prevention, right? You're trying to prevent. So you've already got the disease, wait till the disease runs its course, get better, get some antibodies into your body, which is, well, it's a good thing in a way because you've had COVID, now you have some antibodies, but they're not enough. Then get the vaccine on top of that.
Okay, thank you.
Yeah. You're welcome. Have any more myths and is anybody else? So this is just other news. Again, the passports, we talked about this last, the passport. But back in Manitoba, they're going to issue COVID-19 vaccine passports. Alberta says they're not issuing COVID-19 vaccine passports, but they're talking about it. Our premier believes that they'll, in principle, this contravenes the Health Information Act. And possibly the Freedom of Information Protection Privacy Act. I'm not sure what you guys think about that. But then for travel, that's kind of being worked, it's in the works. Again, they're saying the health authorities in all provinces should be working on this together and looking at solutions because other countries already have these passports, right? So in the US, they can show a CDC card that has your residency status and your COVID-19 status, vaccine status. In England, the NHS COVID pass can be used to show your COVID status. So it can be used for travel. So right now, we don't have any cards we're issuing. When we do go out and vaccinate, we're giving people those papers that show they received their first one. We then put a date when they're due for the second dose. We go back and give them the second dose, and then we write that down. And the information is entered into a system. The IDSM, we do that, we enter all the details, and then that appears on your NetCare. And you also can find that in My Alberta Health. But that's what we have for now in Alberta. Being worked on, and I hope that does happen, that we do get a card. Most people want to, I mean, it's easy to lose a piece of paper, you know, and when you're out there, no one has access to NetCare. So how are they going to know that you have been vaccinated? So I think that's kind of where things are at. Now, I don't know what you guys think about the passports. Currently, where you're storing your proof that you have been vaccinated. How are you doing that?
Yeah, I just think they should just put on the health card or somewhere, you know, not like issue a new passport because everyone have to pay for a new passport.
Yeah, I think it's a vaccine passport. It'll probably be different. It'll be like when you come from countries like, again, Africa, you have the yellow fever and all your cards, and some people have, you know, vaccine little cards that show that they've had their hepatitis B or pneumococcal vaccine kind of thing, but making a passport. I've seen the ones in age just look very beautiful. It's very clear. You can see that someone has received the first and the second, where you got it from, which health authority gave it to you, what date, and how many you've received. So, but yes, so it's a different kind of passport. It's just calling it a passport. You can call it a vaccine card. But our premier kind of has this feeling that it's intervening with people's privacy, freedom of information. So I'm not sure what your thoughts are about that. I mean, I think we should get a card because you have two papers. We give people too big, they can fold them up. You can lose paper, you can damage the paper. You really need a card that you can keep with you when you're traveling, especially outside of the country.
You have a point there. Like the US has a card that they use and is very efficient. So then if you're traveling say to the US, which is a vacation spot for a lot of Canadians, depending on who you meet, sometimes they don't know how to read PharmaSave, Rexall, wherever it is you got it. And then it's interesting because they're like, well, when is this? Did you get vaccinated? So I mean, I kind of see what you mean. Even when you go vaccinate your children, you get the one card. I remember with my kids, you get the card and then they put all the vaccines there and so it's easier. I mean, it's efficient, but I mean, who am I to go against the premier? So
I hear you, Tayo. Anybody else? And especially, of course, again, there's this other thing of the AstraZeneca, which is not being recognized in some countries. So, that's also, I guess we have to first deal with that issue of the third vaccine. They allow you, they don't recognize AstraZeneca, and you have the AstraZeneca, then you've had the Pfizer. Can you travel? I don't know how that's going to go, right? And so we know now that we open on Monday, we allow the Americans to come in who've been fully vaccinated. They're allowed to come into the country. I think they're not opening for us yet. So we're not yet allowed to go to the US. But when we do go, will they accept our one card, our papers? Will they accept people who have had the AstraZeneca and Pfizer? Because they don't recognize, they don't, in their country, they don't. So what if you've had AstraZeneca as your first shot, quickly come and get your you've had your second shot, get a booster. But at least you can show, for instance, the Americans that you've had 2 Pfizers, with Moderna and a Pfizer. So that wipes away the AstraZeneca. I don't know.
I was perfectly good before. You just needed some air. Very good. More.
But then again, people are traveling in the UK, they give AstraZeneca, they're saying that, some people will not be able to go to
Dr. Jennifer.
Other AstraZeneca bits, is that hanging? Yes.
Could you go ahead and mute Hall? I'm hearing some background noise. I apologize for that. If you just went in there, yes, thank you.
Everyone is muted, right?
Well, okay. No, there's still an iPad here, not muted. 2 people are not muted here. I just didn't want an interruption. Communications and policy and politics also is unmuted. But we're 5 minutes out anyway.
Sure. Any last words? I think for me, that's kind of where I'm at with, things are unfolding. My last words are things are unfolding every time. You might go listen to the news in the morning, by the afternoon, something else that has come up, right? But unfortunately, what we're seeing is that the trend, our cases are rising. And maybe this was bound to happen. Last time when we had our first session, the last time, someone said, you can't keep people closed up for forever. But then when do you open, or do you do it a kind of more safer way? I don't know, because it is summer vacation. Kids and families have to go out and have a vacation. But then again, unfortunately, our case has gone way beyond that which we expected.
We have some children manning once again. I think
we've got a few more minutes to go. So last words from people.
Could you be kind enough to mute everybody?
I think thinking.
Dr. Jennifer, can you just mute everybody? Thank you. Oh, can you make me the host actually?
Okay, let me stop sharing and make it.
We'll just take questions right now. Sorry guys, we are almost done. I'm having comments here. Thank you for the presentation. Thank you for coming. I do appreciate that. we're about to round up. I'm just taking last minute questions right now, actually.
I'm trying to see how to stop myself from being.
We have babies on the Zoom. Oh,
I
wow.
know.
Why don't you mute everybody, please?
Yes,
I'm trying to, yeah, I'm
click on the participants down. It says mute all. Thank you for that.
unfortunately, it's okay. Let's see if I can just do that. Okay, there we go. Okay. All right, and then I think everybody's muted.
Yes, everybody's muted now. So I guess we have the floor open out to last minute questions, comments, chat. I'm looking in the chat here. I have people saying this has been awesome. Thank you very much. Thank you, Ms. Pila. I have Stephanie Abioye saying thank you for the presentation. Thank you very much. Does anybody have any questions, comments, concerns, what they'd like to see? We have another one of these Zooms coming up before the season is out. And yeah, if anybody has anything they would like us to talk about or address, this would be a good time to let us know that. No?
And what we can, the last session we have, I kind of just talk about updates and just try to follow the news and bring that to the platform for discussion. I think that if anything else comes up before then, unfortunately, the rising cases, but if there's anything else that, people want to talk about, let's do that.
Yes.
We've heard a lot. We've heard about the variants. We've heard about what COVID is, but now where do we go with this? Is this going to be the rest of our lives? Are we going back to some kind of norm? And how do we do that safely?
I agree. Well, I guess we'll keep our fingers crossed and we will roll with the punches as it shows. I guess that's what we're going to do. Well, it is 7 o'clock and we big on keeping to time. I want to say thank you very much, Dr. Jennifer, and I want to say thank you to everybody who has taken the time out to attend this information session with regards to the vaccine. We are very thankful that you are here. It is important that we keep shedding light on these issues. And yes, and we to continue to let people know, especially in our community, that the vaccines are out there, what they do to come against every myth or misinformation that is out there, that vaccines actually do really save lives. My name is Taya Nathan. I am the Executive Director for LCCMedia Foundation. I am very excited to have my foundation do this. If you need more information, please go on our website, lccmediafoundation.ca. Contact information is also there. You can follow us on all the social media handles. Dr. Jennifer, thank you very much for coming. And I think it's a wrap. I think we're done. If anybody else wants to hang around and ask some questions, Dr. Jennifer, gracious enough to stay, or if they want to ask me questions also, I also will be here taking questions and comments or concerns or criticisms as you may have it. But once again, my name is Tayal Nathan, LCCMedia Foundation is where I'm from. I want to say thank you to Foundation for Black Communities and ECF and the federal government for making this possible, and also to Dr. Jennifer. Once again, more information, LCCMediafoundation.ca. It has been my pleasure. Thank you very much, guys. And that's it, it's a wrap. If anybody wants to stay behind for any questions, we'll be here. Thank you, everybody. That was good, Dr. Jennifer. Thank you so much. There's lots of feedback that I'm receiving.
Oh, good.
Yep, I have comments here. Thank you so much. Everybody's grateful. People are saying thank you for putting this on. Very informative, I find. Thank you for doing. I like the fact that you had the statistics there. It's nice to be able to put this in perspective. Especially in our community, sometimes we forget.
It helps, and I just,
it does, yes.
Unfortunately, unfortunately, the trend is going up. That's the cases are going up in numbers. So
yes, and I think it's expected, and it's been from July 4th to now people have been out and about vacationing, barbecuing, picnics. I mean, it's obvious that it's gonna rise. I do see that happening, but I think that people have learned. I'm very excited that people have learned. They are able to, from last winter up until now that this thing is real. Make no mistakes, it's real. People have died. So yeah, but I'm very happy that you addressed all the myths. That hitting pepper or it's not the 666 or it's not the weird. I think it's interesting.
The microchips and the 5G and oh my goodness.
Well, we are people of faith. When healthcare fails, we rely on faith.
Yeah.
And we need to be able to let people know that faith doesn't cancel out science.
Correct.
And science doesn't cancel out faith, that it can both exist side by side. And I don't know that, and I don't blame anybody for feeling that way, really, because it's been a long haul of vaccine and testing and weird things that have happened to people, especially people of color.
Yeah.
So it's important that we address this and we address it appropriately. So yes, and we have people still here some people just even joined in. I wonder if anybody has questions. Let me look in the chat real quick if there are questions. I have thank you, great presentation. Thank you so much. Thank you so much. The presentation is quite needful in a time like this, so that's really positive for us. We're going to have more information. Thank you for the presentation. We're going to have more information, of course, on the website. If people want to go on our website, LCCMedia Foundation.ca, get more information, more website, or maybe even Dr. Jennifer, your information from Canada HomeCare Group, if you want to check you out or see you for additional consultation too. Yeah.
Sure.
Yeah.
Yeah.
So,
no, thank you.
Thank
you
you
for the
very
opportunity.
much.
So we look forward to next week.
Yes.
Try and get some more stuff.
I'm
Look
losing
at the
your
news and see what's out there, because I think that's we're guided by what comes. We're guided what comes up. It's an everyday things are changing. Morning and afternoon things are different. So let's keep our eyes open, our ears, open, and just see what comes up. Really.
Okay.
We need to remain safe.
Yes, ma'am. Will do. Thank you.
Do the best we can. Thank you, Tay. You have a good evening and a good weekend. Yeah.
Thank you, ma'am. Thank you so much. Thank you, everybody who's still on. I'm going to go ahead and end the meeting right now. If nobody else has any questions or comments or concerns, thank you very much. Really, we appreciate your presence. We do not take it for granted. Thank you, ma'am. I'm going to go ahead and end right now.
Sure. Thank you.
Bye.
Bye.